Hello and welcome to Women's Football Hub. I am your host for this episode. I am Carolyn Kent, and with me today is someone who is an associate professor at the University of Sydney. She's published multiple research papers. She's a former council chair at Sports Medicine Australia, and she's currently working as a FIFA medical researcher looking into brain health. Welcome to Women's Football Hub, Dr. Kerry Peek.
Yeah, thank you so much for having me. I'm really looking forward to our chat.
Oh, thank you. As I said to you before we came on, I'm blown away by people just giving me time who really are in echelons of research that I probably shouldn't even be getting into their email account. So thank you very much for kind of coming on. But obviously you've got a new job that you're working on at the moment. So let's chat first of all about your job as a FIFA medical researcher in brain health.
Yeah, FIFA medical subdivision. FIFA is such a big organisation, you would expect the medical subdivision to be huge, but actually we have a really small team and the medical director is Andy Massey. And so within FIFA Medical, we have the research team, and so that's led by Andreasen. And then there is myself and Ben Clarkson, and that's it. And so we look after a number of topic areas, and I'm fortunate enough to lead most of the projects related to brain health. And considering a lot of my most recent research has been on heading and worked with FIFA as an injury spotter, particularly looking at concussion in, I think, the last 8 World Cups, that this is like a dream job for me.
Now, of course, you haven't always studied concussion. This is something that you've decided to focus on more recently in your career. What kind of inspired you to move your research focus towards football and concussion?
Yeah, that's a great question. I think it just happened through circumstance. I am a physiotherapist by background, and I trained in the UK back in 1997 and was a clinician for a long time. And I just started to transition into research when I moved to Australia. And anyway, early on in my career, I worked with the former England rugby physio, and he really had a clinic that specialised in sports-related neck injuries. And I've always been an exercise-based physiotherapist. I just love exercise, probably because I wasn't very good at manual therapy, but I don't know. Anyways, and so when I was watching my son head the ball as an 8, 9-year-old, I was thinking, oh, actually, should they be doing neck exercises? And then I thought, actually, what is heading the ball bad for them? I don't know. Like, I really didn't really think about heading that much. And anyway, so I started to look at the literature, and it became a bit of a passion project of mine because my PhD was on something else entirely different. And he's now almost 19. And anyway, when I finished my PhD, I moved to the University of Sydney and I got a teaching and research academic position. And I remember my supervisor at the time saying, well, you've now got 40% research. What are you going to research? And I said, I'm going to research heading in football. And that's pretty much how I got into it.
Let's talk about your research then, because obviously you have been doing research. And what are the sort of latest findings in your research on heading and the impact on brain health?
Yeah, we're doing loads of research at the moment. And I guess when I did decide that I was going to do heading and I realized that there were just so many gaps, I did approach it quite strategically or systematically in terms of looking, what did we know, what didn't we know? And I love injury prevention. That's always been the space that I've enjoyed really positioning myself in. And I was really fortunate to be introduced to Tim Maher, who's the UEFA medical chair, really early on in this sort of journey. And they just completed the UEFA heading study. So we use the same coding methodology to then look at heading incidents in Australia, because then the data were comparable. And what we were finding was that as players transition to the 11v11 game, that's when we see this sort of uptick in heading incidents. Young girls tend to head the ball less than boys, but once they start to get to 14, 15, it's actually really comparable. And a more recent study, which was comparing heading incidents and the technical performance of headers between the men's and the women's World Cup, found heading incidence rates were virtually identical between the men and women, but there are differences. And that's really become the focus, because I'm really interested in the role that performance can play in injury prevention. And some of the things that we're seeing, not just in women, but in experienced players, are things like the timing of eye closure. So if you close your eyes early, then one, you're not prepared for the exact moment of head to ball contact because you don't know when it's going to happen. But also, if you're closing your eyes, and I'm not just talking about the blink at the time of the header, because almost everybody does that. I'm talking about screwing your eyes shut and maybe pulling your shoulders up because you're trying to engage your neck muscles really almost passively, that then are you aware of players coming towards you and aerial duels? Do you know that there's an elbow or another head in the way? And so I think that there's lots of things around the actual coaching of heading which have really huge implications for injury risk. And I think that a lot of players, parents, coaches that come and talk to me after presentations, what they're really asking for is what coaching frameworks exist around heading. When should we be coaching it? How should we be coaching it? And so a lot of the projects that I'm completing at the moment are really trying to answer that. And if we can put some resources in place to really help support players and coaches, then that's really the ultimate goal for me.
Nice. And I take it there are maybe specific age groups, demographics in football that are maybe higher risk for head and related injuries. Is that, or am I wrong in saying that?
No, you're right. And I think it's the inexperienced players. So we're also doing some qualitative research at the moment. And again, a lot of this is based in Australia. And what we are finding, again, is just the experience of women and girls when they're starting to head the ball. So very specifically around this, although we are looking at others. And it's interesting because we talk a lot about the gendered environment. And I think that's really important to touch on. But a lot of girls, the experiences are different depending on whether they learn to play football with boys or whether they only learn with girls. And they talk about the strengths and the differences with both, but often we're finding is that those real technical skills, and heading is probably one of the most technical skills in football, is that actually they don't get coached in that until much older. And then the issue also is depending on what the background is for some of the girls. And it's not just obviously related to girls, so I'm generalizing a bit, but we just tend to see a lot more that the boys, some of the sports that they play or exposed to at schools, particularly here with Aussie rules, they have to do a lot of catching. So they get really good at ball tracking and they'll catch the ball quite close to their face. That is one of the foundational skills for heading, whereas the girls might not be exposed to that. And then if we add that to the fact that you've got inexperienced coaches who are not supported within their coaching licenses to teach heading, there also may be concerns about the effects of heading and they're not sure, is it good, is it bad? So then they're not coaching it, but then there's still the expectation of players to head the ball in matches. And my concern is that we should never expect players to head the ball in matches if they do not know how to perform it well.
Mhm. Yeah, and I think that comes back to a few things there is that maybe exposure to multiple sports is maybe good, and exposure to multiple movements is also, we know, good for performance later on. So I suppose there's the elements there. And I suppose that brings us on to maybe heading and how does that affect kind of short-term and long-term brain function in football players?
Yeah, so I think with heading, it's really important to break it down to what the potential risks are. So we have the acute risk, and this is related to head injuries, which might be bumps, bruises, all those sorts of things, but also obviously concussion, which is really important, something that we need to prevent as being a brain injury. So heading itself, as in the actual head-to-ball contact, rarely causes a concussion. It's much more likely to be caused through player-to-player contact through an aerial duel. But obviously you're competing in an aerial duel for a header. So indirectly heading is related to a lot of those injuries. But where the ball is actually involved, it's more likely to be an unintended ball to head contact. And that's really important to differentiate between the two because heading is a skill and that is something that is part of the game, but we want to prevent the unintentional ball to head contact. But some of the research groups that all together. And so it's really hard to unpick when the ball is related, whether that's a header or not. So that's where we have the sort of acute risk. And then we have the long-term risk, which is the area that we know a lot less about in terms of does heading cause long-term issues with brain health? And is it heading? And what is also the association between other head impacts and actual diagnosed injuries? And is this related to age of first exposure? Is this related to the level in which you play? There's a lot we really need to explore more before we can definitively say whether there is a long-term risk, even though logically I think it makes sense, but I just think that there's a huge gap in the research still there.
There is, and there's certain, I always used to remember when I was sitting on the sideline, I used to watch games and free kicks in particular, the players in the wall, when they're standing there about to take, when somebody's about to hit the ball at them, I always used to wonder about, God, I hope they don't get hit in the face. Is that something that you saw as an injury spotter when you were working with the kind of recent World Cups with the youth players? Did you see certain other patterns of injuries?
Yeah, so we did start to see some pattern of injuries, and we are seeing, just to go back to the ball, but the women and girls tend to be injured by the ball more often than men, and so that's a project that we're doing at the moment. In fact, we're doing that with Andrew Ross, who you know is an undergraduate physiotherapist. But yeah, we are seeing patterns. But just on that topic, and as I said, my PhD was in something else. It was related to health behaviour, and I'm really interested in behaviour because when we think about injuries, if we think about knee injuries, for example, there is a whole range of things that can be injured in the knee, and there's a whole range of mechanisms, and they can be direct, they can be indirect, they can be due to stage of maturation, they can be related to overuse. When we think about head injuries, they're actually really quite homogenous as a group of injuries. Like, the structures that are going to be injured is not as varied. And the vast majority, are contact injuries. Contact injuries means there's a behavior there. And so, actually, what we need to do is we need to find those patterns. And then that's how we can really start to work on injury prevention. So, what was the behavior that led to the outcome? And where did it start? And is that related to decision making? Is that related to player positioning? I think there's so many coachable moments. And I've had lots of discussions with various people, and I keep saying, I reckon 70%, in fact, I'd even go as high as 80% of head injuries are preventable. And everyone's, no, that's way too high. And I'm like, no, I honestly believe that, because they just are quite a unique or quite distinct group. But there is a lot we need to understand. Like, it's not going to happen overnight. And injury prevention is such a complex area that even if we understand it, actually changing that behaviour is a whole nother challenge in itself. But I honestly think it's exciting, because I think we really can make a difference.
Yeah, and I think you bring that back to when we are making a difference with injury prevention. I had Dr. Holly Silvers Granelli on, and she was saying when she did her first injury study, the results were so high they didn't even feel they could publish them, because the FIFA 11 Plus prevented so many injuries. And if you're looking at this with regards to heading, it's probably not out with the realms that putting in an injury prevention program can potentially give you results that you might think, God, that is actually high. But let's talk about practical advice for coaches and players. Let's talk about how we're going to help them, because I think one of the big things about research is getting it to the people who need it. And you've already said that coaches and players, or coaches and parents, are coming to you after talks and asking questions. There's obviously a want for the knowledge. What advice would you give to coaches to reduce the risks associated with heading during training and matches?
I think that's a great question, and there's sort of two parts to this. And then the first I want to touch on is just the fact that podcasts like this are really important, because we need to have those mediums that are going to perhaps resonate with different groups of people. Because I think as researchers, we're all a little bit egotistical, and we tend to write for each other, and that's fine, and it's always lovely when you get your first publication. But beyond that, we've got to look at impact, and we've got to look at impact for the people that we really want to make a difference to. And I'll come back to the fact that the reason why I got into heading research was watching my son head the ball. I have to keep reminding myself of that, because I am a researcher, but I'm also a mother. And I recognise that every player has a mother, and every player has other loved ones. And so we have to stop looking at just numbers and have to think about impact on people. And so coming back to what you really asked me about was the practical implications, is that we need to get something that's really usable and really resonates with our coaches and our players. So we have developed a program. This is before I started at FIFA, but related to header prep, and we've done some preliminary work in a football club in Victoria. But it's really trying to think about, if we have the 11 plus, if we add a heading component to that, what does it look like? And I think that what I need to really again emphasize is that heading is a complex skill, but it's so much more than the head to ball contact. It is about ball tracking, it is about body positioning, and all of that we can coach without the ball to head impact. So what we actually start with is actually being able to catch a ball in front of your face. Can you keep your eyes open to the point where it's virtually going to hit your forehead, but you don't let it hit your forehead? And I think that's almost a good readiness test. So we should never expect players to head the ball if they're not ready to do it. And if you get a light ball and you ask a player to catch it right in front of their face, if they can do it and they keep their eyes open, they're probably starting to show readiness to head. If they do this, shy away, duck, they're not ready. And so then we just need to think about the skill development and the acquisition that we would do with every other skill, and just break it down into its components and teach it safely and add the progressions. And we need to do that actually at a really young age, because my concern is with some of the guidelines where heading is banned up to a certain age, if there is no framework to actually get the player from no heading to heading, I think we potentially are going to make injury worse, because if you don't head the ball until you're 14, 15, 16, now you're playing with players who, in a sense, could be women, they could be men. They're now firing rockets at your head, and you're not prepared for this. So we do have to think of heading as a skill. That's the best way to approach the injury prevention strategies, and make sure that our players are ready when the time comes to head the ball.
You mentioned there a lighter ball. Are there other sort of specific techniques or equipment that you feel could potentially make heading safer?
Look, I think there probably isn't necessarily equipment. There is a ball that's specifically designed for heading, but and this ball is actually quite clever because it behaves like a normal ball, but it's much, much lighter. And there are other things on the market where balls are on a string, or there's virtual reality, and there are some complex things. But I think when we actually break it down, it really does come down to skill acquisition. And that then means we need to support coaches on what are the steps involved, who needs to head the ball, and when do they need to head the ball. So we know that central defenders tend to head the ball more than any other player position. If you play on the wing, you don't head the ball so much. And the players that don't want to head the ball, is that okay for them to play on the wing? Probably. Part of that is coaches understanding who their players are and what sort of skills that they have. So I think most of it probably comes down to coaching rather than technology.
Yeah, fair enough. And are there certain positions that are more at risk with regards to head injury? Is there any data on that at all?
Again, this is interesting, and some of this is like preliminary data, and so we need to replicate some of the findings that we have into other studies to see if this is true, because we tend to know that central defenders head the ball more than any other position. So that's true. Or well established in the literature, I should say. But interestingly, they don't always seem to be the group with the highest number of head injuries. So why is that? Is that because they're better or more practiced with dealing with aerial duels, or is something going on, or the way that they've been trained that makes them high prevalence of heading but low prevalence of head injuries? And again, I think there's a lot that we still need to understand, and that's the exciting bit about the area of research that I do, because we just have gaps everywhere, which makes for an exciting job to try and fill them.
Yeah, and I think part of this podcast, the way I looked at it was to try and fill some knowledge gaps. Yes, of course, give advice to players and coaches, but we also get a lot of kind of newly qualified professionals listening to this. And I'll be honest, I always found concussion just not difficult to deal with, because we were very much taught in Scotland, if in doubt, sit them out. But I always got nervous with them. Do you have any advice for newly qualified people who are working with concussion for the first time? Because it's not something that's in a lot of undergrad training for physiotherapists.
No, it's not. And I teach undergraduate physiotherapists still, and I take the concussion lectures, and we have one concussion lecture and we have one concussion tutorial. We really don't cover a lot. And concussion, you talk about prevention, you talk about treatment. There's so much you can cover. An hour doesn't do it any real justice. So what I would say is, don't be complacent. Concussion is a brain injury, and so do read up. And if you're not comfortable with concussion, then absolutely, if in doubt, sit them out. I just don't think you can ever be too cautious. And I think really good physios have really good sort of spidey sense. They just know when something's not right, and you listen to that. And so if you've got a player and you're umming and ahhing, should I take them off the pitch? Are they ready to return to play? I think if you're not sure, the answer is no. No, don't return them to play. And yes, take them off the pitch. And I think the other thing that we've got to be really open to, especially as new grad physios, and I remember being a new grad, even though it was many decades ago, is that we felt, we'd given this certificate of graduation and we had to all of a sudden know the answers, and we don't. So seek mentors, go and find someone that knows more than you do, and just be curious and ask lots of questions. And often, I think that the more you research and the more you read, I almost feel like the more stupid I become, because it just highlights to me how little I know about lots and lots of different topics. Whereas I actually think it was like inverse. When I was a new grad, I thought, oh, I know everything, because I just didn't know what I didn't know. And I think that comes to concussion as much as anything. Like, we don't cover enough in undergraduate. If you don't know the answers, find someone that does, and be as cautious as you can in the interim.
Yeah, you've just described my experience of running this podcast. I thought I knew stuff. It turns out I did not know a lot. Yeah, and I think it's one of those things that this is an area where there's probably going to be a lot of research coming out in the future, obviously, because that's a big part of what your role is at the moment. So what are the key areas of research that are still needed in concussion and heading?
Where do we start? I think we need to understand a lot more about the long-term risks, and why are some players seem to be at higher risk than others, and what is the magnitude of that risk, and what are all the contributing factors. And that's not something we're going to know for decades, really. It's a very complex area. So again, another reason why I like injury prevention, because we can start to make a difference much more quickly. So at the moment, we are working on a project in FIFA where we're looking at a football-specific on-pitch concussion assessment tool. So that will be part looking at the evidence, but also getting expert opinions. So that's sort of like a modified Delphi project. We've just finished another Delphi project looking at heading incidence research, again, so that we can develop a standardized framework. So if you're doing heading incident research, we're all using the same descriptors, we're all using the same definition, and that if we're talking about heading is defined exactly the same way in every single study. So I've just written half of the first draft of that manuscript. So I don't know, that'll be out in about 12 months or something. But, depending on how slow the publication sort of train works. But yeah, we're also developing like a heading research database, which we hope will be public facing. And so every study that has been published on the topic of heading will be in this study. So in this database, so that if you want to go in and find the gaps yourself, or see what's been published in any particular domain, then you'll be able to access that. Because part of, as I mentioned to you, the research department in FIFA is tiny, so we can't lead a lot of those projects. But what we want to do is connect with researchers around the world, find out what everybody else is doing. Maybe we can be the conduit to put people together, so there's not a tiny study being done in Australia and one in England and one in the US. Can you get those people together in the same room and make the study bigger and having more impact? Can we work with others? Is there a way that we can facilitate people having access to FIFA data, because FIFA collect a lot of data? It's really about really welcoming people to get in touch with us. I'm happy to share my email address. You can find me on LinkedIn. That's another way to contact me. But I really want to hear from people. If you're doing heading or concussion research in football, then let me know about it. I want to hear about it. And if I can be of any assistance, then I honestly will. And we will make sure absolutely that we tag you in any of the social media posts that go out so people can reach you. There is one kind of last sort of question that I'd like to ask you with regards to myth busting, because I know that a lot of people have maybe spoke about, more so in rugby, about the sort of scrum cap things that people wear. Let's just chat about that. Good for concussion, not good for concussion. Look, I think any of the published research at the moment is saying it makes absolutely no difference at all. And I think there is this misconception that yeah, you put a scrum cap on and it's going to pad your head and you're going to be all good. I think what we've got to understand is how is the brain being injured? And the brain is being injured by the fact that there is accelerations, and the brain will accelerate when the head accelerates. So you can pad the head as much as you like, but if your head's moving around, your brain's going to move around as well. The other thing is that if you're adding stuff to your head, then your head becomes heavier, which means your neck has to work even harder. And so there's all these other add-on effects. And if you've got a helmet, some people feel that they're a bit more bulletproof, and if you think it's going to prevent you, or you're going to go into tackles much harder. And so there have been evidence to suggest that actually they can make things worse. But then I also want to caveat that with that we are getting new materials and new properties and technologies coming out. So maybe there will be a day where there might be some sort of headgear that will have a reduction in concussion risk. I'm not sure if that will happen, but certainly headgear reduces the number of cuts and bruises in rugby. So if that's something you're trying to prevent, then by all means wear it. If you're trying to prevent a cauliflower ear, it probably helps with that as well. But if the main aim is concussion, then no, I don't think that there is anything really to suggest that is actually going to reduce the risk. And that's really with any sport at all.
Kerry, I cannot thank you enough for giving me your time today. I could have listened to you all day talking about concussion. Hopefully that's been useful for everybody that's listening. And to all of you who are currently working with players, please be mindful of head injury and brain health. Please follow the evidence, and we will see you soon.
Thank you for listening to Women's Football Hub. The information within this podcast is for informational purposes only. No material on this podcast is intended to be a substitute for medical advice, diagnosis, or treatment. Please contact your doctor or another healthcare professional if you have any questions about anything raised in this podcast.